So first of all, I like to thank the organizers for inviting me for this very important topic. Fasting and brain health is a very important emerging topic because there's a lot of research data coming out related to this topic. So before we go to the presentation, there's no disclosure for this presentation. And the effects of fasting on human body are quite diverse. And there's a lot of data, especially in the last 2 decades, research data related to fasting and health. And basically, fasting increases cortisol level, it increases serotonin level in the brain, it increases dopamine levels in the brain, it affects drug metabolism and interactions, and it augments the immune system, and it affects degeneration and regeneration. And that has basically translated into a lot of neurological and brain health data. Now, brain health is very important. This is one of the key priority areas for World Health Organization and World Federation of Neurology, because brain diseases account for more than 20% of all disease burden, including the neurological diseases and psychiatric diseases, which are known as mental health. And now everything is encompassed under one umbrella, which is called brain health. And brain diseases are number one cause of disability around the world. The burden is increasing, especially for stroke, depression, and dementia. So we expect that because of the elderly population, there will be more neurological and neuropsychiatric diseases across the globe, and that will be affecting the brain health of the population. So intermittent fasting is a very popular area for marketing and research these days. This is a marketing slide from a Europe-based company, and they're marketing as that intermittent fasting basically supercharges your brain. Now, the most important data related to fasting is coming from the aging data. Aging is a very important global issue, and National Institute of Aging USA has generated a lot of research data on fasting and brain health and fasting and aging. So fasting has a recognized impact on neurodegeneration and regeneration. So it leads to new synaptic connections, it leads to neurogenesis. And one of the key aging expert, Mark Madsen, he has published a study which has shown that if you decrease the calorie intake, 500 calories of intake every day, that leads to longevity. So it has impact on aging. It also increases growth hormone levels for months, and that also affects the aging. This is a very important paper recently published in New England Journal of Medicine, which is a review article which is showing effects of intermittent fasting on health, aging, and diseases, and which is it's a worth reading article. Now, fasting and other important areas which could be very related to cognition. There are many trials, but I will just quote three major trials. One was a short-term regimen of calorie restriction, and which includes verbal memory. There was another trial with overweight adults with mild cognitive insufficiency, and 12 months of intermittent fasting, and that showed improvement in verbal memory, executive functioning, and global cognition. There was a large multi-center randomized controlled trial, which was longer duration, 2 years of daily caloric restriction. It also led to improvement in working memory. There are many research papers related to effects of intermittent fasting on brain and cognitive function, which have highlighted that how fasting leads to improved cognition, especially improvement in Alzheimer's disease parameters and related to neurodegeneration and cognition. Now, the other important area is mental health. The mood disorders are a common problem. Depression, anxiety, and bipolar disorders are very common across the globe. So fasting, it leads to increased serotonin levels in the frontal and temporal lobe. That data is mostly coming from animal studies, and it also regulates epinephrine, norepinephrine, and dopamine levels in the brain. So it leads to mood elevation, decreased depression, and decreased suicidal thoughts, and that's a lot of that's coming from observational human data, that patients who are able to adopt intermittent fasting, there is a trend of decreased depression and decreased suicidal ideation and suicidal thoughts in those patients. It not only affects the disorders, the mood, but also decreases the anxiety attacks, and that data is also coming from observational studies and small scale randomized studies. So it also decreases panic attacks. It stabilizes the mood in bipolar disorder patients. It has a good impact on mania and hypomania, and also it increases ability to handle stress. So this is all the data coming from fasting and mood disorders. Uh, Depressive symptoms are very common, and this is a large study which was published in a Nature journal, which have shown that fasting has an impact on stress symptoms, systems, and depressive symptoms in patients with depressive disorders. Schizophrenia is also a well-known psychiatric problem. It is one of the most studied area related to fasting, and that studies were done at Moscow Institute of Psychiatry, Russia, and they have published this data, and they have shown that patients who have refractory schizophrenia, they showed 70% improvement in their symptoms after 12 to 14 hours of daily fasting for 3 to 6 weeks. So not only symptoms improve, but the efficacy and responsiveness to the medications improve with intermittent fasting. It augments effects of antipsychotic medications in schizophrenia patients. So there's a double impact of fasting on in patients with schizophrenia. Now, addiction is also an important and well-studied area related to fasting. So fasting decreases the craving while fasting. It decreases withdrawal symptoms during fasting. It also decreases the smoking, chewing tobacco during fasting, and elevated serotonin levels in frontal and temporal lobes, and increase endorphin and enkephalin levels, which are basically related to pleasure and addiction. So there are a few studies in this area with mixed results, but these studies direct you to believe that fasting has impact on addiction, and it could be a part of a strategy if you want to control the addiction, and if you want to withdraw patients from addiction, then the fasting could be an important augmentative strategy. Taste is also well studied, and there is a lot of effects of fasting on structural and chemical composition of taste buds. Now we know for sure that it improves taste, and the studies have shown that patients with decreased and loss of taste sensation, 12 to 14 hours of fasting improves taste discrimination. So it has an effect on taste modulation and perception. Both this is this is a review article which was recently published. Uh, Neurodegenerative diseases, especially Alzheimer's disease and Parkinson's disease, which probably has a huge burden in the world right now because of the aging population, and the burden of both diseases is increasing. So in these patients, the fasting have shown to increase neuroprotective activity. It increases ketone levels, cytokines, and leukotriene levels. And fasting also improved tremor in essential tremor patients and Parkinson's disease patients by increasing dopamine levels in the basal ganglia. And fasting is also shown to delay onset of Alzheimer's disease and other types of dementia, especially in aging patients. So this is another slide which shows that fast you can improve or boost your brain power by fasting. Stroke is also a very well-known neurological problem, and now the data has shown that stroke incidence is decreased during fasting months. And how it decreases by effects of better blood pressure control, sugar control, and cholesterol control. You see decreased tobacco intake in fasting months and increased physical activity. So at a biochemical level, and this is from the animal studies, that you see increased cytokine and brain-derived neurotrophic factor levels during fasting improves, and that's probably associated with improved recovery in stroke patients. Epilepsy is also another common neurological problem, and the data has shown that fasting improves epilepsy control in refractory patients. Fasting improves fits by increasing ketosis, so there's increased ketone levels in the brain, which has a profound impact on epilepsy control, and they have a very strong anti-epileptic effect. So ketogenic diet is a well-proven treatment of refractory epilepsy. And also fasting augments the effects of anti-epileptic medication. So it works both ways. Now, multiple sclerosis is a autoimmune demyelinating disease of brain. And this data is coming from a mouse model that alternative day fasting reduced autoimmune demyelination in mouse models. So there are two pilot studies which have shown that patients with MS and who do intermittent fasting, they show improvement in their symptoms. But the results are mixed, and long-term intermittent fasting data is not available at this point, but the studies are underway. And it is expected that long-term intermittent fasting may lead to reduced relapses in multiple sclerosis patients. Now, sleep is an important part of brain health, and insomnia is a very common problem. About 1 billion people in the world complain of insomnia. Now, what fasting does, basically, fasting increases melatonin levels in the brain and it improves stage 3 and stage 4 sleep. So, this is proven data from several studies. And even one time fasting for 16 to 18 hours, just one day fasting, it improves quality and quantity of sleep. And it is also shown from the study that one time fasting reverses the insomnia related to jet lag. So there is some role of fasting in jet lag related to insomnia and other types of insomnia. It also decreases night terrors. It decreases symptoms of restless leg syndrome, especially during fasting months. It also shows improvement in sleep apnea because it stimulates respiration in central apnea patients. And few studies report improvement in obstructive sleep apnea symptoms too, related to intermittent fasting. Migraine is a very common neurological problem. There is increased migraine frequency in Ramadan at the start, and sometimes these patients may need long-acting non-steroidals for migraine control, especially for the first 1 week of Ramadan. But if someone fast like 2 to 3 days per month, it decreases migraine frequency and intensity in patients who have migraine. So migraine fasting is now well studied and well published area. So a lot of research going on related to fasting and brain health. We need to study sustained effects of short-term fasting because most of the data is short-term effects on the brain health. So this is an area which we should focus that what are the long-term effects of short-term fasting and persistent fasting, effects of persistent fasting, and the neurological effects of intermittent fasting and effects of fasting on community health. Not most of the data is observational data, so we need well-designed randomized controlled trials for neuropsychiatric diseases in future to make a good recommendation that how fasting is going to affect neurological diseases and prevent from neurological diseases. So in conclusion, fasting has a profound effect on brain function. It affects all domains of brain function. It improves brain health. It has an effect of longevity, and it decreases mental disorder, mental distress, and it improves control. It has an effect on sleep and taste. It decreases the prevalence of stroke, epilepsy, and dementia, and it has a huge potential for research. So hopefully, well, I think this topic, a lot of experts who are here related to uh, diabetes and Ramadan and diabetes and fasting, patients who don't even have diabetes, but if they fast, it's going to have a huge impact on the brain health and healthy brain living of patients. So in conclusion, I would like to thank the organizers for giving me the opportunity, and I will be glad to take questions if you have any for this presentation. Thank you very much.